This presentation is a collaborative effort by the University of South Alabama's Suicide Prevention Research Lab, developed as part of a larger series of psychoeducational presentations and trainings provided by the University Counseling and Testing Center in response to the current COVID-19 health crisis. This presentation focuses specifically on suicide prevention and coping. We hope that you will find the information helpful and that you will apply learned skills to maintain your physical and mental health and well-being during these unprecedented and difficult times. In this presentation, we will explore typical reactions in the face of a public health crisis, such as the current COVID-19 pandemic. We will discuss some of the most researched and commonly identified risk and protective factors that may be associated with suicidality, including suicidal thoughts and behavior. We will also identify important warning signs to be aware of that may indicate an increased risk for suicide that you may notice in yourself or others. We will teach some basic skills and strategies for healthy and adaptive coping, with particular attention to staying connected under the current guidelines for social distancing. Lastly, we will highlight a number of helpful services, supports, and other useful resources that can be accessed to aid in coping and suicide prevention. It is important to remember that everyone reacts differently to stressful situations, such as an infectious disease outbreak or other health crisis. How you respond can depend on a number of factors, including your background or other personal characteristics, your resilience and ability to cope, the information and support you have access to, and the community you live in. The outbreak of the coronavirus disease 2019 may be stressful for people, especially given the requirements for social distancing, quarantining, and isolation. People who may respond more strongly to the stress of the current COVID-19 pandemic include those who may be at higher risk for contracting COVID-19 or more vulnerable to the disease, including the elderly or individuals with chronic health conditions, those who are younger and may not understand or have the capacity to cope with sudden changes in their environment or routine, those who are helping with response to COVID-19, such as doctors and other healthcare workers, as well as first responders, and those who may be suffering with mental health conditions, such as a mental illness or substance use disorder. Stress during an infectious disease outbreak can evoke a number of emotional and behavioral responses. Typical reactions can include anxiety, worry, or fear. This may be related to your own health or the health of others you may have exposed or who may have exposed you to the disease. The resentment that your family and friends may feel if they need to self-quarantine as a result of contact with you. The experience of monitoring yourself or of being monitored by others for signs and symptoms of the disease. Time taken off from work or school and the potential loss of learning, income, or job security. And the challenges of securing things you need, such as groceries and personal care items. Other reactions include concern about being able to effectively care for yourself, family members, children, or others who may be in your care. Uncertainty or frustration about how long you will need to remain in this situation, as well as uncertainty about the future. Loneliness associated with being cut off from the rest of the world, especially family, friends, and loved ones. Anger, for example, if you think you were exposed to the disease because of the negligent behavior of others. Boredom and frustration because you may not be able to work, go to school, or engage in other day-to-day activities. Uncertainty or ambivalence about the crisis, as well as best practices for minimizing risk and ensuring the safety of yourself and others. A desire to act out in unhealthy ways, such as increased use of alcohol, tobacco, or illicit drugs in order to cope. And symptoms of depression, such as feeling hopeless, changes in appetite, trouble concentrating, or difficulties with sleep. All of these symptoms are normal in the face of a crisis. However, they can result in declines in mental health and well-being, a worsening of chronic physical health problems, and negatively impact quality of life. Although declines in well-being and functioning are relatively normal in times of crisis, it is important to recognize when there may be a risk for suicide. Risk factors are characteristics, situations, and experiences that have been demonstrated in the research literature to be associated with an increased risk for suicidality, including suicidal thinking, behavior, attempts, and deaths by suicide. These factors tend to be long-standing and unchanging, and may predispose an individual to act on suicidal thoughts or engage in suicidal behavior. Research factors are also cumulative, in that the more risk factors a person presents with, the more vulnerable they may be to suicide. Risk factors inform a person's chronic or baseline risk. We call this risk status. Some of the most commonly identified or well-known risk factors for suicide include a mental disorder, for example, depression, bipolar, or other mood disorder, experience of trauma or childhood abuse, particularly when these experiences lead to low self-esteem or feelings of shame, a history of suicide. This can include a previous suicide attempt, a family history of suicide, or exposure to suicide, for example, through witnessing or learning about a significant suicide death, such as that of a close friend or loved one. Interpersonal and family conflict, especially when that is marked by a history of exposure to violence and aggression. Other risk factors include chronic or physical illness, unemployment, incarceration, and impulsivity. This list is not exhaustive. There are certainly others that have been identified and discussed in the research literature. However, these are perhaps some of the most important to be aware of. It is also important to keep in mind that risk factors are not deterministic. That is, not everyone who has a risk factor, or even multiple risk factors, will necessarily think about or attempt suicide. As useful as it is to be aware of and be able to recognize specific risk factors for suicide, for example, in yourself and others, it is also important and quite useful to be aware of protective factors. Protective factors are characteristics, situations, or experiences that protect or buffer against suicidal behavior, and therefore decrease risk for suicide, even in the presence of suicidal thinking and other risk factors. Protective factors essentially represent the reasons why a person may decide not to attempt suicide. Some of the most commonly identified or well-known protective factors for suicide include immediate supports, such as a family or significant other, the availability of social support. This can include a network of friends, connection to the community, or a religious organization, engagement with a therapist or other professional support person or group, core values and beliefs, such as those held by religions that value the sanctity of life or condemn suicide. Having a sense of purpose can also be protective. This could be represented in a person's desire, for example, to make a difference or to contribute something unique to the world. Planning for the future may be another sign that a person is not intending to take their own life. This can include short-term planning, such as buying tickets to an event or applying for a job, or longer-term planning, such as going to school or having children. Ambivalence about dying can also be protective, in that it represents the doubt a person may have about their desire to end their life. Lastly, some researchers and clinicians have suggested that having a reason for living may be the single most important protective factor against suicide. Reasons for living can include anything from raising children and protecting loved ones from hurt, to needing to stay alive to feed the cat or dog. Again, this list is not exhaustive, and protective factors may be unique to the individual. However, these are especially important to be aware of because a lack of protective factors may also increase risk or vulnerability for suicide. It is also important to keep in mind that protective factors can be fostered. That is, supports and resources can be offered to a person to increase their resilience, instill hope, and enhance reasons for living. Risk and protective factors are helpful in gauging a person's general or baseline level of risk for suicide, and also suggest possible avenues for intervening and providing help or support. However, perhaps more informative and especially important to be aware of in the current COVID-19 crisis are warning signs. Warning signs are essentially red flags that indicate a person may be preparing to engage in suicidal behavior. These factors tend to be dynamic and fluid and may indicate the presence of a current suicidal crisis. Although on the surface, warning signs appear quite similar to the list of risk factors, the point is that we are looking for increases or changes, for example, in mood or behavior. Warning signs inform a person's acute or current risk. We call this risk state. Some of the most commonly identified or well-known warning signs of a suicidal crisis include increases in suicidal thinking, especially when the person expresses desire, intent, or some form of planning or preparing for an attempt, such as obtaining lethal means. Changes in mood, such as an increase in depression, or the presence of indicators of anger, agitation, or restlessness. Another specific warning sign that may be directly related to mood change is withdrawal. For example, a person who is typically very social and outgoing may become increasingly disengaged and isolated. A substance use disorder may be a risk factor, but a significant increase in substance use or current intoxication could be a warning sign. Other examples of warning signs include feelings of purposelessness in life, hopelessness that a situation will never get better, or feeling like a burden, especially to loved ones. Lastly, warning signs could also include behavioral indicators of an imminent suicide attempt, such as writing a goodbye letter, preparing a will, or organizing finances, making arrangements for the care of pets, or giving away possessions. It is very important that when warning signs are apparent, some sort of help, support, or intervention is provided in order to prevent suicide. Next, we discuss healthy and adaptive ways of coping, as well as services, supports, and resources that can be offered to a person in crisis, or that can be practiced and accessed to prevent a crisis. With the stress brought on by the current COVID-19 health crisis, regardless of the potential risk, it is helpful to practice strategies for coping in order to minimize distress and enhance quality of life. However, coping strategies are not created equal. Healthy coping strategies can help in both the short and long term. Sometimes, coping strategies are emotion-focused and aim to help you feel better about your situation. Other times, they are problem-focused and aim to change your situation. For example, it is likely that your social support or level of in-person social interaction has decreased or changed during the pandemic due to mitigation efforts that require social distancing. You can use both emotion-focused and problem-focused coping to deal with this situation. Examples of emotion-focused strategies for coping with social isolation associated with COVID-19 include distraction, that is, keeping yourself busy to take your mind off the issue, expressing strong emotions by talking or writing about your feelings, and meditating or praying for strength or comfort. Examples of problem-focused coping include seeking information or assistance so that you're well informed about how to keep yourself and others safe, maintaining a routine or creating a daily schedule. This might include scheduled work and break times, changing clothes and not working in pajamas, having routine bed and waking times, and thinking creatively about ways to connect with others, such as exercising, watching a movie, or otherwise socializing virtually. There are also general categories of coping, many of which overlap. These include relaxation, for example, taking a mental health day, going on vacation, and engaging in hobbies. Self-expression, for example, talking to others about how you are feeling, journaling, and being creative. Seeking support, for example, asking friends, family, significant others, or clinicians for help or assistance. Reappraisals, for example, reframing situations and thoughts to focus on positive or possible solutions. Spiritual and faith-based activities, for example, practicing meditation or prayer or attending religious services. Helping others, for example, being available for others who need support or volunteering. Engaging in self-care, for example, exercise, healthy eating, and taking breaks as needed. And problem solving, for example, identifying solutions for complex or difficult issues. Now would be a good time to evaluate your current coping strategies. You may consider increasing your use of the ones that are healthy and reducing the use of unhealthy coping strategies, such as overeating, oversleeping, or avoiding. For instance, if helping others has decreased stress and suffering for you in the past, it is especially important that you engage in this activity more now. You might also decide to add in new coping strategies that you haven't tried before, such as writing or talking about your feelings or reaching out to others for support. If you find yourself struggling to cope, particularly in response to the additional stressors and adversities associated with the COVID-19 crisis, you are experiencing significant levels of distress or impairment, or are in crisis or concerned about someone else who may be struggling, you are strongly encouraged to reach out for additional support. The University Counseling and Testing Center provides counseling services to the USA undergraduate and graduate student community. Due to the COVID-19 pandemic, the Counseling and Testing Center is not able to provide in-person counseling sessions. However, telemental health counseling is currently being offered via phone consultations and face-to-face video conferencing to currently enrolled USA students who are screened as being appropriate for this form of counseling. Students requesting a phone consultation or video counseling session are asked to call the office at 251-460-7051 during business hours and leave a message which includes your name, JAG number, and phone number, and your phone call will be returned. There are also a number of resources and supports that can be accessed in the Mobile community. The USA Psychological Clinic is a training clinic associated with the University of South Alabama, providing a range of low-cost psychological intervention and assessment services, including individual, couple, and group therapy. The clinic is currently offering skills for psychological recovery, brief telepsychology consultations for stress related to COVID-19. More information about this service can be found on the USA Psychology Clinic website. Lifelines is a human service agency providing professional counseling, assistance, referrals, prevention and education services, and crisis intervention, as well as family and consumer credit counseling services. Appointments can be requested online or directly by phone. Lastly, the National Alliance on Mental Illness is the nation's largest mental health organization, providing education, advocacy, and support for individuals and families affected by mental illness. Local level services include family support groups, a recovery support group, a peer-to-peer mentoring program, and a monthly educational meeting. In addition, NAMI operate a free peer support service helpline, as well as a text line for individuals in crisis. Beyond the supports and services available at the community level, a number of national resources can be accessed for those who may be suicidal or otherwise in crisis. The National Suicide Prevention Lifeline provides direct support for those who may be considering suicide. Callers will be connected with a trained crisis counselor who can make referrals to local mental health services, as well as provide information for survivors and friends and family of survivors on finding a therapist or support group. The Trevor Project provides a crisis intervention and suicide prevention lifeline for lesbian, gay, bisexual, transgender, queer, and questioning youth. In addition to the helpline, there's a 24/7 online instant messaging or confidential text messaging service to connect with a Trevor Project counselor. Finally, the Crisis Text Line provides 24/7 support for individuals in crisis. A live, trained crisis counselor will respond to help you move from an emotionally overwhelming place to a sense of calm. During this unprecedented public health crisis, many people across the country are feeling the stress of the coronavirus. There are concerns about becoming ill, uncertainty about the future, possible financial strain, and dramatic changes in all of our daily routines. Individuals respond to stress in different ways, which may depend on their risk and protective factors. For example, those with a pre-existing risk factor for suicide, or those with limited protective factors, will more likely to experience negative impacts, for example, on their mood, anxiety, sleep, and overall well-being. Staying vigilant to warning signs of a suicidal crisis in yourself and others, and implementing both emotion and problem-focused coping strategies can be crucial during this time of added stress and vulnerability. Falling back on strategies that have worked in the past can be useful, but you may also want to try out something new. Ultimately, do what works for you. In addition, there are resources both locally and nationally to help you cope and feel connected. Reach out when you need support. You're not alone in this. Together we can cope and we can prevent suicide.